So when we're talking about the rural healthcare expectations through this, the expectations are all based around increased access to healthcare to those people in the rural areas that maybe don't have time or the ability to drive 30, 40 minutes into town to go to the doctor. This can be achieved through more walk-in doctor's offices in small rural towns. By doing this, these farmers and people in rural areas would not have to make the long drive to a city near them when they need a doctor. This could be like a CMH walk-in clinic or a Cox Health walk-in clinic in those small rural schools, towns that have small schools, not just your big Springfield, Bolivar, those kind of places, but get down into those small 1A, 2A high school towns that could have a walk-in doctor's office for all those people in the rural area. Another way could be through more telehealth style doctors. I think that we've had a big increase in technology, and I don't know that they really utilize it as well as they could at getting healthcare to those rural places. I think that there'd be a learning curve, obviously, getting people on board with it, but having that ability to see a doctor on the while you're on your phone, maybe out in the field or at home at the farm, would be extremely beneficial for those families out in rural areas. The possible future and how this will affect the ag industry. Walk-in clinics in rural towns. This will affect the ag industry, allowing farmers to get access to healthcare easier and quicker, which will keep them on the farm and not having to take a day to go into town and go see a doctor. And that'll just help production all around, no matter what they're doing. And then pediatric doctors, as we've kind of touched on with child health, pediatric doctors would be beneficial at those walk-in clinics or through the telehealth doctors. So your babies out in these rural areas, they don't have to go all the way into town to get seen, or if they get sick, those are pretty urgent deals. Having a walk-in clinic local would help tremendously with those babies and their sicknesses and stuff.
Righty, I get to talk to you about the health of current standards of Missouri, which are not kind of great, but that's okay. So, deaths are higher in rural areas for heart disease, cancer, accidents, opioid deaths. They're up to 105.6%. The top causes, again, are heart disease, cancer, chronic or lower respiratory disease, accidents, and stroke. Now, a lot of these could be helped or possibly even prevented if we had healthcare on wheels. And that's what this entire presentation is going to be about. We are trying to get rural healthcare in Missouri available to farmers in not so great regions. For example, if you looked to my beautiful Missouri teal and yellow chart over here. And yes, it is Missouri because, um, you will see that Boone, St. Louis, St. Charles, Greene, obviously, as well as Clay, Jackson, they all have some pretty good hospitals. They all have really good Medicare and they all have really good care for the customer. If you get up into Harrison, Mercer, Grundy, Sullivan, right up in that bright yellow block of counties, you will see that there is absolutely nothing. And unfortunately, that's where a lot of our farmers do reside, are in these rural areas with a lot of yellow. So, since it takes probably 2, 3, maybe if you're lucky, 1 hour to get to hospital from one of those counties, you might have a problem if you're seriously injured and it's not readily available, or they're going to life flight you and it's going to cost you an arm and a leg, literally. So, we are proposing that we have healthcare on wheels that can come to them and educate them and try to improve their quality of life. The maternal child weight has been significantly lower in rural countries. The health access is just not there. And there it's the distance and the transportation, and there's not a lot of providers because there's not a lot of money. So if we could find a way to fund this to get them out there and have somebody actually go out to their county, which is what these people in Virginia do, then it would be a huge impact for all of our farmers, which, as we know, are currently running the country, trying to feed all of us in this beautiful economy we have. With that said, I'm going to pass it off to my next presenter.
So to understand rural healthcare, we got to break down 5 factors in it. The first one will be telemedicine. Living in rural America comes with a cost of seclusion, especially for farmers lacking high-speed internet. On top of this, there's coverage barriers and licensing walls for out-of-state providers that may be able to solve certain issues relating to chronic illnesses or other niche issues. The second is financial struggles. Rural healthcare centers serve less patients than urban ones, thus, less funds for said center. Add in low reimbursement rates for Medicaid or Medicare, supply chain issues, and federal healthcare programs like Critical Access Hospitals program, like that face ero- erasure from existence. Another one is labor shortage. The main cause of low labor levels is inadequate wages. Also include lack of access to medical schools in rural America and the underfunded or under threat policies like J-1 visas, which actively support rural Missouri hospitals being being ceased from activity. Another one is opioid abuse. Because of how labor intensive farming can be, farmers are prescribed with more meds than others, include a lack of medical assisted treatments, addiction specialists, and delayed help due to license removal or location. And you can get this can lead into the next factor or worse, overdose. So for farmers, the suicide rate is 3.5 times higher than compared to the general population. The ignore it and work mentality is often how a lot of farmers live. But the stress of seeking profits, climate change, debt, physical pain, and more will drive most into a rash form of thinking. And while most rural hospitals lack a physician, almost all of them lack therapists. So, with all this being said, I guarantee the target audience for this, although this is a presentation for the Missouri Farm Bureau, we write these words with the intention that anyone, regardless of educational background or any other learning barriers, can understand us. All farmers who suffer from the factors listed just now are who we are talking to. The people that feed us with little in return are the main people that we feel should listen to these words and benefit from what we're offering.
I get to talk to you about the origins of the Health Wagons mission. So, this wonderful woman up here is named Sister Bernadette Kennedy. She prefers to go by Bernie, however. It was founded in 1980, and she began delivering free healthcare from a Volkswagen Beetle, which was donated. She has driven through many various mountain roads, bringing medical care directly to the doorsteps of people who had nowhere else to turn. Her mission was born out of a real need in places where hospitals were hours away and where many people simply went without care. And if that sounds familiar, it should, because it's a lot like Missouri. She went to the underserved people of Alpatia, which, if you do not know, is in Virginia, and we are trying to get them out here. The Health Wagon has its roots built on trust and community instead of buildings or big money, a lot, unlike hospitals. As you know, hospitals will charge exorbitant amounts of money just to do a simple procedure for no apparent reason other than they can. Her belief was that everyone deserves to be seen and heard and healed. From the simple beginning, the Health Wagon has grown into a network of mobile clinics, permanent sites, and telehealth programs. But its spirit remains the same: go where the need is greatest and never turn anyone away. Some of the ways they do this is by using various techniques such as, I can get it to work, telemedicine. I believe my group partner has already gone a little bit more in depth, but I'll just hit it because it's here. So it's connecting rural patients with specialists remotely. They led the region in telehealth, and they've actually become one of the biggest telehealth usages, right up there with, I believe, Kaiser Permanente. They also provided free or low cost for their procedures. They do this by volunteers and community work, as well as donations. They secure grants and donations in order to operate and minimize patient costs through partnerships. They utilize their labor shortage by recruiting volunteer and medical professionals who have been duly trained in order to cover multiple roles. They partner with universities and hospitals in order to try to use some of the budding medical students, and they treat patients for addiction and overdose. Unfortunately, opioid abuse, especially in Missouri, has skyrocketed. We are now at officially 105% greater than we were last year, I believe, for opioid abuse. These guys are trying to educate the population on substance abuse and try and prevent it. They also distribute Naloxone kits, which are used to counteract the the effects of opioids. They attempt to help their patients get into clinics and try to recover from the opioid. Moving on, there is more, but that is for my partner to share.
Something important about the Health Wagon is it provides mental health and trauma support to storm survivors, including in the aftermath of Hurricane Helen. They really do try to connect with the community, so they have volunteers as well as education and outreach. As far as concerns, something I found that is mildly concerning was their CEO was getting paid an extremely high salary of almost $500,000. That was reported on by Cardinal News, which is a Southwestern Virginian news outlet. Now, when it comes to funding, though, they get most of their funding through donations, grants, as well as some funding from state governments. Now, where that's important is going to be in getting them to come to Missouri. So currently, the Health Wagon is mainly focused on the Central Appalachian region of the United States. As you can see, southwestern part of Virginia, as well as the northeastern part of Kentucky and Tennessee. So getting them to come all the way to Missouri is going to be a little bit of a push. However, again, they do get some of their funding through states. So if we can convince the state of Missouri to invest some money into this program, I believe we could get them to shift a little bit further west than they currently are. So the first step really is going to be an education, telling people what the Health Wagon is and why it matters. Uh, Hopefully, once people are aware of the issues facing people in rural communities when it comes to healthcare, they'll care a little bit more and they'll want to see those solutions, which I think Health Wagon really is a great solution. Now, a great way to be involved in this would be reaching out to the parties that could make this happen, include state representatives, the Health Wagon leadership, and really talking to anyone and everyone